Dermatologist Dr. Denise Buntin is here to take your phone calls. Already got a couple on the air. As always, great to see you.
Good to be here.
All right, we have got Lashana on line one. Lashana, we thank you for watching, and go ahead. You're live on the air.
Yes, I have a question. I wash my hands a lot with my work because I'm a nurse, and my hands are dry and peeling. And I just want to know, like, what would the doctor suggest for me to use to help with the peeling of my hands?
Okay.
Exactly. I share your problem. This time of the year with frequent hand washing, you can get very dry. I look for moisturizers that have ceramides in it. One brand is CeraVe, and then there's some other Eucerin, they have ceramides, and those increase the moisture content. And then if you get a little bit of redness, you might try hydrocortisone over the counter, and then of course if that doesn't help, you can always see a dermatologist.
All right, we've got Megan with us right now. Megan, thank you for watching, and go ahead, please.
Yes, I am 14 weeks pregnant, and the pregnancy hormones seem to be doing a number to my complexion. So I was just curious what is recommended for the best face wash and lotion if you are expecting. My skin is also very dry.
Right. If you're pregnant, there are a few things that can be used. Benzoyl peroxide, you have to be careful. You'll need to ask your gynecologist. But in the office, we usually prescribe clindamycin, a prescription, or Finacea, a prescription. They're category B. So I would say talk with your gynecologist, and then if needed, a dermatologist can give you some pregnancy-specific treatments for acne.
All right. We have got Megan. Is this Megan again on 4 second? I'm sorry, Jane. Jane is who they're telling me. Jane on 4. You're on the air live. Go ahead, please.
Yes, doctor. I have a fungus that has appeared on my finger, on my fingernail at the back, and I've never had fungus on my toenails or fingernails before. It started out with just a little white spot near the cuticle, and then it peeled, and then there was a yellow spot came up, and now it's just white, but it seems to be spreading.
Well, the reason why you don't know for sure it's fungus without a test, you could actually have psoriasis that can give you white spots and yellow spots. So I know you're thinking I'm a broken record, but you need a dermatologist because we would do a scraping and possibly a biopsy. And remotely, you always worry about skin cancer too when somebody has something new on the nail, including melanomas. And some melanomas are not pigmented, so don't put it off. I want you to get evaluated for that one.
All right. Right now, we have Linda with us. Linda, thank you for watching, and go ahead, please.
I was diagnosed with psoriasis this year, and I'm having a hard time with it. And I was just wondering, does it ever go away?
Well, psoriasis is a chronic condition that can be limited to one area or your whole body, and we do treatments either topically or orally depending on the severity. Things that can influence psoriasis are alcohol, cigarette smoking, weight gain, particularly in women because it's an inflammation. And in fact, if you have psoriasis, you're at greater risk for cardiovascular disease, so you need to make sure you're having a physical exam. I would say work with your dermatologist. There are many treatments. People get very frustrated, but there's always hope for psoriasis.
All right, as always, great information. Thank you for being with us. Have a Merry Christmas.
Merry Christmas to you, Mr. Snowman.
Thank you, thank you. He likes the tie. If you would like to get in touch with Dr. Buntin, her office is in Hermitage. You'll find her contact information on our website at newschannel5.com.